Hello viewer, welcome to GPS TV Africa. This is Health Talk Show. Today we are going to discuss about one of the common conditions that face many elderly people, but now it is becoming a major problem to our young people. We are going to discuss about arthritis, and I am sure you are going to enjoy the show because this is a very critical issue. And in the house with me, we have our daktari who is going to take us through the show, and I am sure you are going to enjoy it. I am your host, Lucy Wanza-Kariuki. Welcome, daktari, and kindly introduce yourself.
Thank you. Thank you, Lucy. Hello, viewers. My name is Dr. John Murebi. I'm a consultant physiotherapist working at Tipaberev Consultancy. It is my pleasure and thank you for giving me this invite so that we can educate our viewers on the issue of arthritis.
Yes.
Yes.
Welcome to the show.
Thank you.
It is a cold season during the cold weather, and I am sure there are some people who cannot be able to walk, who cannot be able to do their normal duties, or are on their stocking, and they really need that warmth. Kindly introduce this beautiful topic.
Before even we introduce the topic, Lucy,
Yes.
allow me to educate to our viewers on what is a joint.
Yes.
Because at the end of the day, arthritis involves all our joints. A joint, it is the end of the bones where the bones connect to each other. A point where the bone come together into contact, that's what we call a joint. For example, if I want to see what makes a knee joint, knee joint is made up of the distal part of the femur, distal here means end part of it, and the proximal part of the tibia, that is the bone down the knee, and the small bone around there called the patella. That is what composes of that joint.
Yes.
Now, when we come to this topic of arthritis, arthritis is a disease that affects the joint connecting the bones. It can manifest either like acute or chronic pain.
Yes.
What do I mean by acute and chronic pain? Acute pain is pain which does not extend more than 3 months. But chronic pain is the one which goes more than 3 months. How does this condition manifest? It's more of pain, swelling on the joint. Sometimes the joint become inflamed. And when this inflammation comes, we come and get something like this patient has discomfort in mobility, in walking, and the stiffness accompanied all on that joint is what we call arthritis.
Yes.
Yes.
Does arthritis affect specific joints? Because we know the body is made, you've said that a joint is a connection between bones.
A bone and to another bone.
Bone to another bone.
Yes.
And we have various bones in the body. We have bones of the hands, bones of the head, bones of the spine. Which specific bones or joints are you really talking about?
I'm talking about all the joints.
All the joints.
Yes. It can be either the ankle joint, it can be a knee joint, a hip joint, a wrist joint, shoulder joint, or even the metatarsal bones. They are all joint. But now, they are on this joint, there are specific type of arthritis which will affect a certain joint. For example, there's this type of arthritis whereby it will affect either the big joint, and there's another one which will affect the small joint. And that's what we're ending to.
But in general, arthritis cuts across all the joints.
All the joints.
Thank you so much. Now, can you kindly tell us the burden of arthritis in our country, in the world?
You know, in a scale of 0 to 10, we can give arthritis like 6 out of 10, because like almost everybody who moves, any patient, anybody, even you today to see when you are moving, you are subject to getting arthritis.
Yes.
Because there are predisposing factors that can make you get arthritis. For example, obesity. What does name obesity mean? If you go and test your BMI, that is body mass index, that is your weight and your height. There's that level whereby you need to be, let's say, for example, in between 18.9 to 24, that's the normal range.
Yes.
But if you exceed there, that is obese class 1, class 2 as you continue. So if you have more weight than your height, you are subjecting yourself to compressing the joint. Remember, we have said the joint is end of each bone to the other bone.
Yes.
So that the in between the bone and the other bone, that's the joint. If your weight is more, you are predisposing yourself to arthritis. There's also the cut down of the family. If there's any leakage or if any sort of arthritis in your family, you are going to get arthritis. Also, gender. There are those arthritis that you can get either being a female or being a male. Also, you see many arthritis going for surgeries. People get surgeries in any joint whereby a neurosurgeon is capable of passing by. You might get arthritis by the name post-traumatic arthritis. Okay. So everybody is subject to arthritis. That's why I'm saying in a scale of 0 to 10, 6 out of 10 of patients to attend a certain place, they might get arthritis.
Wow.
Yes.
Yes, this is so surprising because many of us are walking then with this condition without knowing. So now, what is your advice on the clinical signs and symptoms which will make someone to go to the hospital or to even imagine this could be arthritis? After all, there is the diagnosis.
Good.
Yes.
You know, in a clinical setup, there's something called symptoms and there's something called signs. Yes. Symptoms, these are things which patient comes with reporting. Yes. For example, if a patient comes with pain at the ankle joint, there's pain, there's maybe stiffness, there's swelling, there's discomfort when walking. Let's give an hypothesis. Hypothesis and indicated guesswork. Let's give an hypothesis that that one could be an arthritis. So those are symptoms of arthritis. But now signs, it is what we as clinicians, we try to diagnose using our special test, trying to use our lab materials to confirm truly this is what? Arthritis. You as a patient, you will not know the signs. What you will come with as chief complaint are symptoms, which is pain, stiffness, swelling, and the difficulty in walking. Yes.
What do you mean by stiffness?
Stiffness means...
to the viewer.
To the viewer, what I mean by the one stiffness here means there's something called ROM, that is range of motion. For example, the knee joint, when I try to cross it, that is flexion. When I do flexion, there's that available range of motion that knee joint is supposed to go. When I try to extend it or I try to
put it straight,
that's now another range of motion which is maybe 0 degrees. We use an instrument called goniometer. So if that joint is not able to do those motions, let's say it is not able to be, you cannot flex it, you cannot extend it. So that is what you call stiffness. Because stiffness is when there's no available range of motion of that joint how it's supposed to move. When I try to do this, I'm trying to flex the wrist joint. When I do this, I'm trying to extend the wrist joint. So if I don't get any of this, that joint has stiffness. That's what I'm talking about. Okay. Yes.
Wow. You know, it's good to understand so that we do not just talk of stiffness, because I thought when you talk of stiffness, it is something that can maybe not crack. Because we've seen people using stiffness to mean cracking.
Yes, cracking.
And if I may ask, are there some specific family lineage who cannot be able to move their joints, yet there is no sickness, there is no arthritis?
There are things called endophalic. Endophalic means there are things that the cause is unknown. Yes. For example, someone can be born by short muscles, having short muscles. Short muscles here means an example of a biceps muscle. A biceps muscle is the muscle around this area. Yes. If this muscle is shortened, it is not able to extend the
The arm.
The elbow joint.
The elbow.
You know, when I do this, I extend the elbow joint. The biceps and the triceps back, these muscles are agonists and antagonists of each other. One does opposite of the other one. If one muscle is short, that patient might not able to get that available range of motion, but yet the patient has no arthritis. So shortening of the muscles also can bring what? Stiffness if the patient has no arthritis. Yes.
Okay. What are the different types of arthritis that maybe affect our viewers, our patients, our relatives?
Okay.
Yes.
The most common arthritis that people know, the most common that anybody know, Rosie and Dr. John know, the most of them, there are many types of arthritis, but I would want to just mention and explain few to our viewers. The first type of arthritis is OA.
OA.
Yes, a full name of OA is osteoarthritis. And osteoarthritis, it is tear and wear of articular cartilages. What does this mean? When we were discussing about, when I was giving definition of a joint, I said the end of one bone, when it comes to contact with the end of the other bone, in between there is a joint. But at the end of this bone, there's a structure around there. There's a structure around that called cartilages. So when these cartilages start to wear and tear, it's now when we give it an OA. How does it come in? It comes in as a result of, it can be handy, it can be slippery, and then when that bone gets worn, that cartilage gets worn, now you will start feeling that cracking sound. That is OA, osteoarthritis. There's another type of arthritis called rheumatoid. Here, immune system. To our viewers, the immune system is the system which protects you from diseases.
Yes.
Now, sometimes the word, I want to mark the word mistakenly. The immune system can mistake its system to bring it more of like it's a bad thing to me. So when this immune system get attacked to itself, it will affect the joint part, which crosses that part, and then now the membrane around that part, called the synovial membrane around the joint now, it can get affected and it get inflamed. This is called rheumatoid arthritis. This is how it affects people. For example, when your immune system is down, it will now come in and send antibodies, which are another name of antibodies to our viewers is army, jeshi. The body send antibodies to that part, and then they try to fight that thing which has been mistaken, the tissues which has been mistaken to be abnormal. Because it is the role of the immune system to detect if there's anything which is not supposed to be in that joint. It fight it. So if it is mistaken that, if there's a mistake that a joint or the synovial membrane around that joint is not mine, the immune system will fight it. And then it will bring what? Rheumatoid arthritis. That's the now type number 2. Type number 3, we have arthritis by the name gout. Gout arthritis, it is whereby it's a disorder of purine metabolism. What does this mean? Accumulation of uric acid in the joint tissues will cause gout arthritis. For example, this is a type of arthritis whereby it affects the small joints. Like when we go down there on the foot, the big toe is one of the victims. The fingers, you get some swelling there. You get some. It's very painful. Even the fingers of the hand, even the big toe down there. That is the gout arthritis. So accumulation of uric acid, either as a result of sedentary lifestyle, whereby you are a smoker, you take a lot of alcohol, and people eat a lot of nyama choma outside there.
Oh my goodness.
Yes. These are one of the causes of gout arthritis. The fourth arthritis, before we even go to the fourth arthritis, there's another type of gout, which is called pseudo gout. The one is pseudo here, Rosie and our viewers, it is a force. For example, you can go and get a force joint. A joint can develop another joint around this part. This is a joint which does this and this. This is the wrist joint. But you will come and realize that there's another joint which can come and form around here, which is not a true joint because maybe I'm the one who has developed it, you don't have one. So it is called pseudo. Pseudo means false joint. So there's a pseudo gout type of arthritis. Now remember, the first one, which is the gouty one, it's more of uric acid which is being accumulated. The purine metabolism is not biochemistry.
Yes.
But I don't want to teach our viewers about chemistry because that's not their line.
Sure,
but
sure.
for the doctors who are watching, allow me to reiterate to you what you know. On the pseudo gout, which is also called acute synovitis, here now, instead of the uric, it is the calcium phosphates. It's the one which gets accumulated. Then when it forms those crystals now, it affects the joint. And now, mostly now, it affects the big joint like the large joint now, which is like knee, the ankle joint, the elbow, and the wrist. But for the gout, it affects the small joint, which is the fingers and the big toes. This is the difference between the gout and the pseudo gout. So we are still on the third type of arthritis. There's another one called acrossing spondylitis arthritis. Acrossing spondylitis arthritis, it is a severe type of arthritis now which affect the vertebral column. Remember, there's this question that you have asked me, Lucy, that does this arthritis, do people get arthritis in all the joint? I told you yes. For this type of arthritis now, it comes in now and affects the vertebral column. This is now the back part of it, the back. Whereby
the area that carries the
yes,
spinal
the area
cord.
which carries down the spine. It can be chronic with a lot of pain, and even they can bring to disability. I think you have even seen people getting some also again pseudo joints. Pseudo, we have seen the false joints and the vertebral column, and then maybe the spine bends, the spine forms scoliosis. Scoliosis is whereby you bend one side. This is where now for this one it affects the joint like shoulders, hip, knee, and even the vertebral column. That's not the fourth type of arthritis called AS, acrossing spondylitis. The fifth one, which might be few know, remember we have said the predisposing factors of arthritis. We have age, sedentary lifestyle, maybe being obese, family history, maybe previous injuries, infection. There's another arthritis called juvenile arthritis. This is an umbrella term which describes arthritis of the young kids, that is the pediatric now, below 16 years.
Yes.
It affects also the soft tissues, it affects the joints. So for these young kids, the cause is also unknown, which we call it what? We call it idiopathic. Idiopathic, I mean that the cause is unknown.
Yes.
Maybe the kid can develop such condition either at age of 5, 7 years, 10 years. Yes.
Okay.
Yeah.
Now, Daktari, apart from the juvenile arthritis,
Yes.
most of these other types of arthritis
Yes.
affect adults. What could you say about that?
Other types which affect the
Adults.
adults. You know, the pathogenesis of how this thing happen, and as I told you, the other types of arthritis, they are more of risk factors which causes this type. For example, if you subject yourself to a repetitive injury, you are just trying to wash your clothes, you just fall down and got either a contusion or hurt on the knee. Today, you can go treat yourself with some few drugs, some few analgesic around there, you get better. Tomorrow again, you can go and get the same injury. You are subjecting yourself to a post-traumatic arthritis. The other one, let's say for example, you are a footballer, you play a lot, and you have been spraining or getting strain on the ankle joint. Again, you are predisposing yourself to arthritis.
Okay.
Yes. Maybe there are other conditions like maybe infection of the joint of the bone. If you get any infection of the joint of the bone and you don't get the best medication, again you will subject yourself to this type of arthritis.
Sure.
So, what happened is that apart from now for these kids who have juvenile arthritis, other type of arthritis can get to any time of your age, And but more so, the osteoarthritis get you as you try to get older, because the more as you get older, your bone, your calcium try to go down. So the bone density reduces. So you are prone to tear and wear again of the articular what? Cartilages. Yes.
Okay, thank you so much, because I am just imagining how many people come to visit the hospitals every day with joint pains. And I'm sure they are listening, and some are going to get some assistance. You know, when I was talking to you, we talked about gout.
Yes.
Because we have seen so many people go to the hospital, and then the diagnosis is gout, the diagnosis is arthritis, regardless of which part of the body. And it has been linked to lifestyle. How can you talk about lifestyle and arthritis?
That's a very good question, Lucy. To our viewers, you know, when it comes to matter of health, we need to be very careful with how we do our things. For example, the gout arthritis, it's as a result of, we have seen it's more of purine metabolism.
Yes.
It's more of accumulation of uric acid and renal dysfunctions. Let's say, for example, if you have issues with your kidney and all those stuffs. But in the lifestyle on day-to-day life, or how people live their life, if a doctor tells you, please, taking alcohol, it is excessive alcohol to your body, it will bring you harm. You know, if you try ignorance, you know what will happen. Secondly, we always advise our patient to be active. Like, let's say, for example, Lucy, where you live, you don't work, you just sit down from morning to evening. You don't make your bones active. You don't try to, you know, what you consume, it should be directly proportional to what you get it out. For example, if you eat and you don't do exercise, the excess energy is stored in muscles and in liver. And for information, when muscles get this energy, muscles don't divide, don't help any other tissue around. This is ours. So they store it. And when the muscles store this energy, they will compress the bone, because a muscle attaches to a bone. So when this muscle has a lot of energy and the joint, it tries to compress the joint, and you get subjected to this arthritis. So to our viewers, this is what I would advise them. Lifestyle, sedentary lifestyle, it is not good as far as arthritis is concerned. Get out, do exercise, go jog, run, go play with your children. Don't eat a lot of nyama choma, don't drink a lot of alcohol, don't smoke. You see? But, you know, there are smokers who are listening to us. But I don't want to say that those who smoke, they don't have a direct ticket to heaven. But I'm saying those who smoke, they are predisposing themselves to arthritis. Those who take alcohol, I'm not saying that they don't get direct ticket to heaven, but still again, they are subjecting themselves to this condition that we are discussing about. That's how much I can say.
So you've talked of alcohol.
Yes.
You've talked of nyama choma.
Nyama choma.
What meat then should they take?
We have seen too much of everything is poisonous. I would advise our viewers, they concentrate more on white meat. White meat. Yes. Other than the red meat. Yes. And I've not
classify the types of red meat we have and the white meat that we have.
The red meat that we have, and goat meat is red meat.
Goat.
Yes. Goat meat. You know, people say that pig is a white meat.
Yes,
no,
it looks white.
It is not. What you see is just the fatty and the postissues. Pig is also red meat. An example of white meat is fish, chicken.
Fish and chicken.
Yes, those are the examples.
Those are white
meat.
Yes.
But others, the cow and the goat and the pig and all those are all red meat.
Yes.
I've not said you don't take the red meat, but I've said take a portion of red meat. If you want to take red meat, if you love red meat.
The other time I was listening to a nutritionist and she was saying a quarter kg of red meat should be taken by 4 people.
That's very true.
And I'm just like...
That's very true.
That is too small.
And there are those who take even 3 kgs.
Yes. Plus alcohol.
Plus alcohol. And then also...
What other drinks apart from alcohol that we should avoid?
You know, excessive alcohol taking, it's dangerous to our body. Because I need a couple of like maybe 30 to 20 minutes to explain how alcohol is banned. But I think you will give me another opportunity to come and teach you about this. Other type of drinks that I would advise our viewers to avoid is drink like you know, sugary. These sugar things, sugar thing. Also, sugar is another silent killer. Anything which is very sugary, you need to avoid it. Also, don't take excess salt. Don't take excess sugar. Anything which is sugary, also try to avoid it. Because if we try to mention all type of drinks here, some of these companies will call us and tell us that maybe we are trying to to put into their jobs. Yes. Yeah.
Viewer, this is GBS TV Health Talk Show, and we are discussing about arthritis, and Daktari is here with us to tell us how we are going to know that what we've been experiencing is really arthritis. Daktari, karibu.
Thank you. As we had said, Ruse, and to our viewers, when trying to diagnose arthritis, remember different types of arthritis that we have mentioned, they have all different types of tests to confirm and ascertain that that is the arthritis. But most of the symptoms that this patient comes with in our clinic, it is pain around that area, either symptomatic or asymptomatic pain. Also, there's swearing around that area. There's also that lack of mobility and the stiffness. These are some of the symptoms that the patient will come with reporting. But there are other tests that either we take to the lab to confirm. We do brand tests to confirm that truly this patient have what? Arthritis. We also do a radiography, an X-ray. An X-ray will show you some osteophyte, the formation of osteophyte. After the cartilages have been worn and teared by this disease, they will in the bones there will be those species around that area, around the joint space. Yes.
You're trying to tell us that this joint is like 2 metals put together.
Yes.
And after some time, there will be some wearing out. But that is exactly what happens to our joints, such that when you look at the X-ray, you'll be able to see peelings, holes.
Have you ever tried to sharpen a knife?
Yes.
There are some few things that you see outside there. That's how osteophyte looks like in the X-rays. Because you have seen that in between one bone and another bone is a joint. And around that area, there's a synovial membrane, there's cartilages, the end of the each bone. So if they start tearing out, you will start seeing those osteophytes. And you conclude this is arthritis.
The reason I wanted you to take us through that conclusion or diagnostic procedure is because we've seen some of our clients, some of the patients, some of the people with complaints walking to a chemist, walking to a shop and buying some drugs. And the thing they go and say is that, I feel like I have arthritis. You're given a few tablets. And this is something that you need to talk about, over-counter drugs and self-treatment.
This is one of the people that we as clinicians, we like condemning so much, because when you go and try to treat yourself, you are doing more harm to yourself. And for information, Lucy and our viewers, the strongest killer is poor diagnosis. If you diagnose that you have malaria, you go and buy malaria drugs, and what you want is maybe typhoid. You are giving yourself you are not treating yourself. Instead, you are killing yourself. So to our viewers, take this home. Do not feel pain, joint pain, and you just go buy drugs of arthritis. Malaria, if you have malaria, malaria will come also. Symptoms of malaria, you will still feel joint pain. So for us to conclude, we as clinicians, we have our own ways of concluding that this is arthritis, this is malaria, this is typhoid.
Yes.
But when you go and start buying drugs of, maybe, the other day I saw a patient at the chemist trying to buy those creams. I want to go and apply around my joint. I feel like I have arthritis. So all these over-the-counter drugs, I wouldn't discourage them not to buy drugs without any doctor prescription.
Yes.
Yes.
So what are some of the management that you have for arthritis?
Very many. Very many. But you know what? In medicine, it's a teamwork. Before we get the right treatment, you can get a lot of different medication.
Yes.
But allow me to mention a few of these treatment. First, you know what? Muscles, they are dynamic. Bones, they are static. Dynamic here means movement. Static means stand, still. So, when a joint get an osteoarthritis, for example, if you have today, you have osteoarthritis of your right knee. Remember, we have said the definition of osteoarthritis, it is tear and the wear of the articular cartilages around that area. So there are muscles which insert, or they go and insert to that joint where that problem is. There's another joint, there's another muscle which will go and pass over that joint. So what happened when you get this arthritis? Then dynamic, the one which tells the bone that has moved, they will gand. When these muscles gand, you will start feeling pain. Now, the pain will not be on the joint. The pain will be on the structures around that area. The structures are the ligament, the tendons, the cartilages, and everything. Now, if we come in and we give a contract relax technique to that muscle, we give it more strength to that muscle. Here, we are treating that joint. Because if a joint has gotten tear and wear, why are you going to replace it other than surgery? And putting it some other external devices? No. So our focus on treatment of arthritis, we try to focus on symptoms, which was pain, swelling, stiffness, and lack of mobility. Then the role of me, like an orthopedic clinical specialist, I'm go more again to focus on joint function. The functional mobility. What does this joint prevent you not doing? Am I not able to bend? Am I able to sit? Am I able to squat? If I'm not able to squat because of this arthritis, it's now where I need to focus my effort. Most of this treatment, every doctor will review them in different ways. There's the drug management of the arthritis, whereby we will come in and give the painkillers. The painkillers here, and our viewers, they will just reduce pain, but they will not have any effect on the inflammation. The inflammation is that is the swelling, the redness that you see there around that joint which is affected. To our viewers, let's describe the knee. As we said, the knee is made up of few components. The distal part of femur bone, the proximal part of the tibia, and the patella bone. It is what makes what? The knee. So when we come in, we give painkiller. You know, the communication between the brain and the part which there's pain, the pain is not at that part. The pain is in the brain.
Yes.
So when we give them drugs try to cut and get theory. And get theory is how the brain communicate to send more signals to the part which has issues. White blood cells, go there, please fight for something is not happening at the knee. You get it? Then there are other drugs called NSAIDs, the non-steroid anti-inflammatory drugs. Now, these are the drugs that we will give the patient to reduce the inflammation, the swelling. Okay? The other drugs called the counter-irritants drugs. These drugs are like, they're not the cream. You see people applying the gel, the chlorphenic gel, to reduce that pain. But all this is just an ingredient which makes the hot pepper spicy. Like, for example, how do you get, let's say, tea? How do you make it more sweet? By trying to add what? Sugar. Okay? So the counter-irritant drugs, these are the creams now to apply around that area. But do you know what they do? They just try to break, they just try to transmit the pain signals, to reduce it, the pain signals to the brain. But they don't heal the knee completely. There's other types of drugs like the biological response modifiers. Then these are the type of inhibitors that try to reduce pain, that try to reduce swelling around that area. There are other called the corticosteroids drugs. The corticosteroid drugs, these ones are the drugs which suppresses the immune system. For example, do you remember the rheumatoid arthritis that we were discussing about? The immune system invade the structure that they feel that this is not mine. But instead, they try to reduce the harmony, the antibodies, so that now the rheumatoid factor can be suppressed. Now, that is now the type of the drugs. That's the drug treatment. Let us leave that one for the pharmacist. Okay? Let's go now to the orthopedic part of it. This is the area where I cough. Now, in this area, we try now to focus on improving the mobility and now restoring the use of the affected joint. We also try to look for strength of this joint and endurance. Lucy, strength of a joint is like if I'm able to lift something down, up, I have strength of lifting that thing. But for how long can I lift this thing? That is what we call endurance. So now, remember we have seen that if a joint is affected, now where in our reference is the knee joint. The knee joint, because it has been affected, it has that osteoarthritis. There's that tear and wear of those structures around there. So the muscles and the other structures around that joint, they will gant. They will form, they will come, and the muscles will have abnormal contraction, which we call muscle spasms. The muscle spasms now here, it's trying to guard, to protect the joint from more damage. So when we come in now, this muscle which is trying to protect the bone, it is doing two work. Remember, it was a dynamic muscle. It is one which was trying to tell the bone let us move. Now it is coming again in to protect what? The bone. So by this, the muscle will fatigue. And when it fatigue, the strength, the endurance, the function of that joint will not be.
Yes.
Our role here now is to restore what? That fitness. It is to restore that muscle to its function. So we come in here and try to give it more strength so that it can do now two things at the same time. Because remember, the wear and the tear, we are not replacing it. But there's other now, the other chances that maybe, remember we gave this type of arthritis to be either acute or chronic. We said acute arthritis, it is the one which lasts for less than 3 months.
3 months.
But for chronic, it's the one which lasts for many months, years, and all of you. But what about if now this joint has been invented, it has been crushed into pieces, and now when you try to step down, you cannot do anything. That's now why we come in now with the surgery. We try to put some other external devices to support that knee to have a longevity of life. The other way of treatment, we also give assistive devices. Like, have you seen people stand here in town walking with the frames, walking with the walkers, walking with the wheelchairs, all this? Remember, when we were trying to check on the predisposing factors, obesity, if we try to compress or we try to press the joint which has been compressed due to arthritis, and you have obesity, or your body mass index is high, if we try to do that and you step down again, it will still again give you a lot of, a lot of pain. So we try to give you assistive device to support you to have partial weight bearing. Sometimes we even ask patient to do swimming, because when you swim, you exercise the whole of maybe maximum of 360 muscles in the body. They are in action. So the other thing again, we try to put some orthotics on the foot. If you have, there's maybe issue with the ankle joint, with the knee joint or the hip joint. But if this severity of this disease, it has affected you so much, now is when we can think of, when we see your X-ray, let's say for example the knee or the hip joint. If we see there's more reduced space at this area, then now we can think of now going for surgery to try and see whether we can do total knee replacement, total hip replacement. That's now where these things come in. But there's one thing also I want to wish our viewers to know. Because we said arthritis affects almost all the joints. There's a joint in the body, maybe the nerve passes through that point. But so if we get this now, remember we said the end of the bone, one end of the bone and the other end of the other bone, it's what makes the joint. And this is where the arthritis is in. So if there's a nerve which passes through that place, this nerve will be compressed. And when the nerve is compressed, there will be now, it will bring now some numbness. Yes. It will bring some pins and needles, paresthesia. It will give all those discomfort. Yes. So again, we can now think of, when we see how these muscles, these bones are affecting the nerve, we come in again now to decompress, to do a distraction, so that we can reach the nerve to do its function. For example, you can be having arthritis of the hairbone joint, and still at the same time you have a lot of numbness. A lot of numbness. Yes. Yes.
Thank you so much, Daktari. This is very helpful and very educative. Kindly, in 1 minute, tell us how to prevent and control as you give your parting shot.
Good. How are we going to prevent this jargon? Arthritis, everybody is a victim. I would advise our viewers to do exercise. Exercise? They stop sitting down at home. They reduce the level of alcohol intake. They reduce the nyama choma. They have a regular checkup. Like they can be taken like 2 to 3 months and then go to the hospital again for checkup. And above all, diet. It is the best medicine. Thank you so much. They eat well. When they eat well, they get better, they move better. Yes. And tell the viewer where to get you. Our clinic is at Parklands Ngara. In the Russia Towers. It is called Tibabu Health Consultancy. They can reach us through www.tibabu.co.ke. They can call us through 0798 079039. Thank you so much, Daktari. It was a pleasure for us having you in the show. As you can see, viewer, our arthritis is a journey. It starts slowly. It starts from day one, continues. So what we can say is that you can be able to diagnose early through the slight signs and symptoms that you face, and I am sure early treatment will be able to help you a lot. We've seen people die of arthritis, whereby it has spread to the heart, to the lungs, and to various parts of the body. Viewer, this is Health Talk Show, GBS TV Africa, and I am sure you are going to keep on listening to our shows, and next time we will be talking about joints and movements of the body, which will enable us to understand more on all these joints of the body which can be affected by various diseases. I was your host, Lucy Wanza Kariuki, GBS TV Africa Health Talk Show.